Hi, this is Dr. Kulbersh with Carolina Facial Plastics, and this is our patient Gail, and today we're going to be talking about doing a liquid eye lift with a cannula. Gail came into the office today complaining of she had some bags that had been forming over her eyes, and she wanted a non-surgical way to correct the bags. And so we had previously discussed, and she has some volume loss in her midface that we're going to replace with some fillers, specifically Restylane and Perylene. The great thing about this filler is not only we're going to get rid of her bags, but what we're going to do is we're going to also give her back her proper cheeks. Because when she's lost the volume underneath her eyes, it gives her bags, but it also changes the level of the cheeks. So when we do this, her cheeks have now sagged and they've come down here, so her highest point of her cheek is way down here. So as we put volume back in this area, we're going to give her cheek back right here. She's got a very pretty cheekbone. It's going to come all the way across instead of having this hollowness, this divot here. She's going to get a cheek back in this eye area, and she's going to lose his eye bag. And we're going to do this with a needleless injection technique or using the cannula. What we first do is we do a baby injection of some numbing medicine to the skin. It's a tiny needle. It's the same size needle as the Botox. And this is actually the only needle used for the whole thing. What we do is we just do a very small baby injection underneath the skin. So we're just going to grab the skin and we're going to squeeze it. And then it just barely goes in underneath the skin. It goes barely in. And we make a tiny little wheel. And it's really injecting about 0.1 milliliters. And then we stop. And that's all the injection that we're going to do as far as the needle. Now this area is already numb. What we're going to do is we're actually make a small hole in the skin through the little numb area. So the area is already numb, so the patient's not even going to feel this. So you take it, and it's just a tiny little hole that just goes right up to the numb area. And through that tiny little hole, we're actually now going to place the cannula. The cannula is unique because it's blunted at the end. This is not a needle, it's blunt. And then this slides gently in through the small hole I just made. And then I squeeze her skin. I just have to get through her skin. And then from there, I can start feeling the whole area. So I gently move over. And this has numbing medicine in it. And so then you slowly start doing the liquid eye lift. And from this, let's do a series of injections to this hole to fill the entire area to do the liquid eye lift. And how did that feel, Gail?
It felt fine. It was very comfortable.
And that's one of the wonderful things of using the cannula instead of a needle. It's more comfortable. It only requires one small hole to fill the entire eye area. And that's using a cannula to do a liquid eye lift underneath the eye.